With the threats to the ADA and barriers in the Senate, what can be done to safeguard the health care of people in your district?
We have passed bills to continue to cover people with pre-existing conditions out of the House. Unfortunately, we're seeing an attack on the Affordable Care Act, which could dismantle the coverage for folks with pre-existing conditions. I'd just love to see a show of hands here. Who in this room knows somebody or has pre-existing conditions? I'm raising my, so literally every single one of us. This, folks, is why it is so important that we don't dismantle the Affordable Care Act. This is exactly why we've got to make sure that we protect that coverage for people across this country. The economic impact on folks who have pre-existing conditions and their families, if they don't have coverage, is going to be astronomical. I remember back to the days, and it's one of the reasons why I got into this job, when I had my second son. He's 17 years old now, but when my husband and I had our own small business, we bought our own insurance. Well, we couldn't afford maternity coverage because maternity coverage wasn't covered under a plain plan. You had to buy a rider for that. And that cost $1,000 a month, and you had to hold that in place for at least a year before I got pregnant. Well, that meant I had to spend $12,000 out of pocket if I got pregnant on day one, the minute that insurance kicked in. I'm still paying that extra $1,000. I couldn't afford that. So when I had my second son, I'm sorry, I'm getting my two sons confused now. My older 17, this is my 15-year-old. So when I had my second son, we literally had to sell my personal items just to cover the cost of his medical bills because I had a baby in the hospital. Folks, that is the time that we would go back to. If you are not covered by some type of insurance through your business and you become pregnant, that is exactly the time that we will go back to. We have a lot of young people standing here, and I am so thrilled to see all these young faces here. So many of our young folks want to build their own destinies. They want to create their own jobs, their own pipelines, their own opportunities. They want to be able to have good health care coverage, but they don't want to have to be tied down to a particular job just to make that happen. And that's why it's so important that we continue to protect the ACA, that we build on it. I want to introduce, I think we should be able to buy into Medicare as a public option so that everybody can have a choice that works for them. Yeah.
Yeah, but didn't all the providers leave the ACA? In the state of Iowa, all the providers left because it didn't work financially. So how are you going to address that? It's great. I like what JFK said. Ask not what your country can do for you, but what you can do for your country. I think it's about time we start talking about all the programs we're going to have. And we start talking about, hey, the debt it's going to leave our kids, our grandkids. All we've talked about here today is all the programs, all of the programs. And how do we fix this? ADA was going bankrupt, or ACH was going bankrupt, and everybody knows it in this room. That's a false premise.
Listen, we're all here to answer some questions. I'll answer this and then we're going to move on because a lot of folks have actually been waiting and we've got a stack here of folks who actually put their questions in, and I want to honor that
Republicans
as well.
Be interrupted. Hey, I'm about tired of the Democrats being so angry.
So thank you. Good to see you again, Gary. Always nice. Happy New Year, by the way. There were some faults with the ACA. We all know that. We know that there are many things that need to be shored up about it, and some of the provisions that were taken and some of the concessions that were made are the reasons why we had that issue occur. You're absolutely right. And that was because too many people weren't able to come together and really craft a plan that was going to work for everybody. We created some unintended outcomes as a result of it, and those have to be fixed. I couldn't agree with you more. But but taking away coverage for folks when they need it isn't the answer. The answer is fixing those issues, just like you're pointing out, so that we can have a solid system that works for everybody.
Hey, just one point though. Are we going to have we going to have another pass it and then we'll read a type situation? Stop. Wait your turn.
This question
We're
is
gonna have to
from
keep it down for the other customers in the restaurant, okay?